Yes, so as Cassie mentioned, thank you all for being here today for this great alumni program. My name is Ida Zaleka. I am a junior. I am studying social policy and I'm interested in healthcare. And I'll be moderating the conversation today with Mirabella. Would you like to introduce yourself?
Yeah, thank you so much. So my name is Mirabella Johnson. I am a second-year transfer student here in Northwestern studying cognitive science and global health studies. I'm in the Waldron Student-Alumni Student Council, so I work with Cassie and the amazing Waldron team a lot. So I'm happy to be here today, also assisting with the conversation.
Awesome. Yes. And as we all see, we have a great lineup of alumni speakers to share their insights with the group today. Once we hear from them for about 40 minutes, we will take questions from the audience. If you want to turn on your mic to ask your questions, please submit your questions via the public chat tab and we'll call on you. If you would like to read the questions out, if you'd like us to read the questions out loud to our panelists, send them to Mirabella in a private chat. And so without further ado, we can start with the introductions. So would you like to start? Keyra, did I pronounce that right?
Yes, perfect. Hi guys, my name is Keyra Thurn. I graduated from Northwestern from undergrad in 2014. And then graduated from Northwestern with my physical therapy degree in 2018. So I was down at the Feinberg School of Medicine for that degree. I just wanted to kind of introduce to you what I do. I'm a physical therapist. I've been practicing for 4 years now, and I absolutely love it. I'm in outpatient orthopedics, so I see a lot of sports injuries, athletes, runners, but also see a lot of kind of an older population. So think like a total knee replacement or people who struggle with balance, things like that. A lot of post-surgical patients. So after they've had a big surgery, they'll come and see me to kind of get back to their normal level of activity. So really how I got into this field was I had an interest in healthcare when I was in undergrad at Northwestern. I was kind of on the pre-med track and kind of midway through, I found myself hating it. Just feeling the struggles of like organic chemistry and all the sciences. And I was like, man, what am I doing? So I actually went to career services, took one of the career aptitude tests, was like, okay, am I missing something? But it kept pointing me towards healthcare. So I started exploring other healthcare opportunities, what else is out there, because there's a lot more than just kind of the doctor track, which is what so many of us are familiar with. So I started exploring. I ended up volunteering at a skilled nursing facility up in Evanston. Helping in their rehab department. So I would help transport patients for physical therapy sessions and help engage them with certain exercises that were prescribed by the therapist. So I really got to know a lot of the patients there and got to know their stories, which is what really drew me to the field because I felt like I got to know people really well. And it was a team effort in getting people back to their functional level. And I just felt more of like a personal connection. And that's, I think, what I was looking for in my healthcare journey. So I had kind of done some shadowing in some other fields with doctors and things. And I was like, I think I just need a little bit more of that one-on-one personal connection. So to give you a frame of reference, I spend an hour 2 to 3 times a week with each patient. So it's a lot of one-on-one time where you get to know people over a span of anywhere from like 6 weeks to 6 months or a year even. So it's really cool. It's been a great profession for me. And it took me a little while to find out where I wanted to be, but I ended up in a place where I'm really happy with what I do and I love it. And I think I'll leave it at that for now. Thanks, guys.
Thank you. And can we continue with
Hello, my name is Anthony Ward. I am a clinical therapist or psychotherapist, whichever way you want to call it. I have a master's in clinical psychology from Benedictine, and I went my undergrad at Northwestern, and I graduated in 2006 with psychology. Just like Keyra was saying, pre-med track, made it all the way to senior year, and yeah, stopped at bio, like second quarter. And it just was one of those things. You want to find a way to help people. You want to find a way to connect to people, to be, uh, to kind of be special in the world, to give back, to have some kind of contribution that you can offer to the world. And, we all come to Northwestern with an idea that we want to do some big and special things. And it's pretty rigid and narrow what we think that thing will be. So we all want to be a doctor, but then we don't know what kind of doctor, and then we don't, all these other things that come up. So it was my sophomore year where I took intro to psychology, and I was like, wow, this information and the way in which they're trying to talk about the brain and talk about, sociology and things of connection between human beings, this is the thing that I kind of do naturally, I felt. I've always been a part of a lot of groups, but I don't think people always accepted me. So I've always been on the outside looking in. And I'm pretty talented guy. I also played football while I was at Northwestern. I sing, I dance. So I was part of like these diverse groups of people, and I never fit a box. And so it was like I was always in a fishbowl of some sort where I'm like looking out at people, and people are like peering in at me. It's like this oddball. And so now, as a clinical therapist, I'm able to make friends with people. All the time, I have a caseload in private practice as well as in a residential treatment facility that's right over here in Evanston, called Rice Child and Family Center. And with the agency, I deal with young people who have complex trauma. So if anybody knows about the ACE study, they've gone through at least 7 out of 10 ACEs, adverse childhood experiences. So abuse, neglect, sexual abuse, a witness to domestic violence, witness to the mental health struggles of their parents. And so these young people have been through a lot. And I think they have honed my skill of like connecting and understanding the way the mind works and how our thoughts connect to our actions and our feelings. And then in private practice, I go from ages like 4 to all the way up to like 74. And across the lifespan, and it gives me a chance, an opportunity to meet with people, sit with people, hear their story. And while they're in the office with me, it's like a joint effort at rewriting their narrative, rewriting what they're experiencing. And it's just very rewarding. There's like no day that I leave not having felt like I've contributed something to the people that I'm interacting with. So that's a very big blessing and a sense of abundance that comes from doing what I do. And yeah, it's part of the healthcare field. So it's not something I thought I was going to be able to do or wanted to do when coming into Northwestern, but it's definitely what I believe I'm called to do. So I'm thankful for it.
Thank you for sharing that. Next, can we have Vanessa introduce yourself?
Hello, my name is Vanessa Gregg. I use she, her pronouns. I am speaking to you all from Charlottesville, Virginia, where I am an OBGYN on the faculty at the University of Virginia. So I was at Northwestern as an undergrad. I graduated in 1996, and I got my degree in psychology. I started out doing pre-med sciences. And, I'm hearing a theme that I think resonates for me in that when I was doing some of my pre-med sciences at Northwestern, I really questioned whether it fit with what I felt like I wanted to do, particularly doing organic chemistry. I sort of thought, this doesn't feel real to me, and I don't see how this could be my life. So I actually walked off the pre-med track at Northwestern after organic chemistry, and I focused more on developmental psychology. I was really interested in cognitive development, human development, and I was thinking I would get a PhD, and I was fortunate to work really closely in a cognitive development lab at Northwestern with David Utah, and had a lot of wonderful experiences there. But then as I got closer to graduation, when I realized what my life as a PhD faculty member would look like, was really a lot of time at a desk, writing grants, writing papers. And I thought, I'm not sure if that's really it for me either. So I moved to DC I did some random jobs, and I finished my pre-med sciences, and I went to med school at George Washington University in DC. Then I came down to the University of Virginia for my residency in OBGYN, joined the faculty in 2007, and I've been here since. I am the director of the Division of General OBGYN, which means I run a division of 10 faculty and some advanced practice providers. I deliver babies, I do gynecologic care, and I'm really passionate about taking care of people having babies and the babies, and also education in healthcare as well. So I would say I did not have a straight path to where I am, but I'm definitely in the thick of the healthcare world now.
Thank you very much for sharing that as well. Yes, organic chemistry. It gets all of us. And lastly, can Samir introduce yourself, please?
Hello, everybody. I just glanced. I'm the oldest person on the panel, like on the whole sheet. So I graduated in 1994 from Northwestern. Probably some of my path overlaps a little bit. I went in not knowing what I really wanted to do. Had medicine maybe in the back of my head. I had thought about law. I thought about something in economics. And so then I just kind of sought out some exposure to medicine, doing some volunteering at Evanston Hospital, did some research on Alzheimer's with one of the professors at Evanston Hospital. And then really, I guess my avenue into medicine had to do with almost like just basically an inherent interest in my major, biology. And so that for me, just as opposed to other areas of study, and we had a broad area of study in different disciplines, that one just felt the most real to me and the most practical and really just inherently the most interesting. So that kind of set me off in motion for going down the med school route. And so I went to the University of Cincinnati and again, exposed to different types of fields in med school. And then I had a particular mentor, I would say, in dermatology. And I did a 2-week rotation with this person, and that was it for me. And so I enjoyed a lot of the components of dermatology. Visual kind of based practice was a particular interest. So did the training in dermatology, and then after that I did a fellowship in dermatopathology, which is a mouthful, but that's skin pathology. So if you go to see your dermatologist, they take a mole off, it gets tested. I have a lab and I interpret those specimens. So after I got done with that, I opened a private dermatology practice, just me, and I did that. And over the years, grew it into a decent sized practice. There's 15 doctors in our group. And so I still love and enjoy seeing patients and then reading the pathology slides. Along the way, there was a business component to growing a practice. We had 80 or 90 employees. So I sort of got my business degree unofficially by just going and jumping in through the process. And so for me, that's been very interesting as well, learning on the job, the business end. So a few years ago, we sold the practice, to a private equity firm based out of Canada. And now I'm pretty much just concentrated on the clinical aspect of my work. So that's kind of how I got here. So.
Thank you very much for sharing that. Yeah, thank you all for sharing kind of like the path to where you are now. The important classes that that have inspired you to go through to the field that you're working in right now, and the experiences that have been really crucial for that, for understanding what you want to do. So kind of like going off of that, how does your art and science background and the classes you took maybe in college play out in your career today? And we can start with how we started the introduction. So Keyra, if you want to start that one.
Perfect. Awesome. So it sounds like we have a lot of psychology in the room. I also majored in psychology, and that is playing a huge role in how I interact day to day with my patients. As a physical therapist, one of the biggest things that I have to do each and every day is motivate people. And so getting into kind of the what motivates people, how are people motivated, how am I going to get someone to invest in themselves, to want to help themselves, because oftentimes I'll have patients who come in and they don't want to do the work. They want me to do the work. And it's kind of this team effort that needs to be built together. So I would say a lot of my psychology, like psychosocial skills, have really played a big role in my day-to-day interactions with people, because it's you know, in any sort of healthcare industry, especially when you're client or patient facing, it really comes down to how do you interact with people? How do you make them feel? How, you know, if you're not a motivator for other people, they're not going to want to stick around and see out the process. So I think that that's a huge category that I would say the psych classes really helped me build that kind of foundational information to help me build relationships with people and understand what motivates people and how are we going to interact with them.
That's great. I really like that. I think every class that I took had some kind of effect on me. Like it either gave me information or it gave about the world, or it gave me information about myself. What I'm good at, not good at, what I am passionate about, what I'm not passionate about, the things that I struggle with. So I think that that's one aspect of it. I think the other thing is that there's a cross-pollination of ideas, right? So in different spheres of what you are learning about from the arts, the sciences, it helps you kind of just weave them together in new ways. To me, there's like a constellation that kind of forms, like the different points of information allow you to see a picture that you wouldn't have seen if you only knew one siloed information set of things. So I think just being as diverse as you can in your experiences and in what you're learning and what you're seeing, and taking as many of those extra classes as you can that are diverse, I think that's also helpful. And then the other piece, that as a clinician, as a therapist, as a person trying to connect with new people daily, I have to have what I consider like different ports of entry for me. So if you can think of like the surge protector that you have under your computer table, where it has multiple places you can plug into, I think that that's what allows me as a clinician to be helpful, is that I have multiple places that people can plug into who I am. So that's knowing yourself, that's knowing what you're good at and all those things. And I think their experience at university can allow you to do that. And I think not just simply having the classroom experience, but also the experience I consider like the cafeteria thing, where you're like sitting down and philosophizing across the table with other people from other majors. I really enjoyed that for myself. So whether it was sitting in Sergeant Hall and sitting down there for 2 hours as people come in and out, entering your table and leaving your table, like those conversations allowed me to see the world through the eyes of other people. And then it's not that you put people in boxes, but you start to, as different as we want to be, we're very similar. So you start saying like, oh, you remind me of this person, and that person like this. Okay, and this is a way that I entered into the conversation with them, and you throw it out there and you see what sticks. So I think, yeah, learning as much as you want to learn and as diverse as you can, and just realizing that you're learning about yourself through the process is what I would say.
That is excellent. And I totally agree with that. I think for me, I learned a lot about human behavior in the study of psychology that informs my understanding of the things that I deal with in the hospital and in our clinics, and the complexity of human life and the things that people go through and what they need to do to survive. I'm working on an MBA right now, and I find I still draw on things that I studied as an undergrad, like some of the statistics and things that I learned through undergraduate coursework that helps me both in medicine, but also in learning about business, and some of the analytical tools definitely play across. But I agree with what Anthony said about sort of diversity of experience. Some of the most amazing classes I had at Northwestern were well outside my major. I was fortunate to take a couple of classes with Leon Forrest, who was an African-American studies professor at Northwestern, who passed away actually not long after I graduated. But through him, I learned about a lot of literature and culture that otherwise I would not have known about, and really broadened my experience as a student.
Thank you very much. And Samira, would you like to answer that question as well?
Yeah, mine kind of dovetails on what the others said. But, I think obviously for me, biology and my strong interest in that, that's the basis in some respects for, what I do on a daily basis. But I think that, I kind of picture it like a pyramid. And as we get older, we go up this pyramid, and we at the top, we become who we are and specialize in what we do. But under that, on the first few layers of the pyramid, are all our experiences. And that could be, the economics or the sociology or the psychology courses or the biology courses I took. And we've all taken all these different types of courses. But it's also, I think, like Anthony said, some of the human, interactions and experiences we have. And this goes back to high school, or the terrible summer job we had, shoveling stuff and all this kind of stuff. So I think for me, all that stuff, although not sort of immediately always relevant in daily life, in the specialized nature of what I and the others do, it's a piece of us, and it comes in sometimes in strange ways. And I think for the others that are facing patients and seeing patients on a daily basis, they're a broad population. And I think when we have had a broad experience, I think we can tend to have more things to talk with them about, or more ways to kind of relate to them about, rather than, okay, I did science, I never had a job until I was a doctor, and this is here I am. You don't kind of understand the world as much. So I think, and for me, I did the same thing. I was taking music classes, which I don't really have a music inclination, sociology, economics. So I think that broad experience really, for me, was huge. So.
Yes, thank you so much for all those insights and like connections from like the classes you took all the way to what you're doing in your day-to-day now. And so kind of going off of like the theme of firsts or like the previous experiences, can you tell us maybe about your first job, maybe in the field that you're like currently in, and like whether it was exactly what you were looking for, or just kind of like the insights you had on that, and we can have like the same follow through.
Cool. I will jump in. This is a good question for me because I'm still in my first job. So PT school, just so everyone kind of knows, it's a 3-year doctoral program. So I went through undergrad, finished in 2014, took a year off, and then did the 3-year doctoral program at Northwestern, and then you graduate with a Doctor of Physical Therapy. So once you're done and you have your Doctor of Physical Therapy degree, you can really practice in any setting you want. So it's not quite the same as like the medical field, where you kind of then go on to a residency and specialize. You can do that if you like to. If there's a specific area of interest for you, you can do a residency within physical therapy. But you don't have to. So you're trained to be a generalist, and you can work in a hospital setting, you can work in an outpatient clinic, you can work in women's health, so doing like pelvic floor physical therapy. You can work in like a cardiac rehab, so picture people who have cardiovascular disease and don't have the same level of endurance that they once had. So working on, can we just like walk to the bathroom? And monitoring their cardiovascular, their vitals while they're doing that to make sure that they're safe. So there's really quite a variety of different areas you can go into as a physical therapist. I think I probably work in the area that most people are most familiar with, and that's outpatient orthopedics. So, if you sprained your ankle and it was really bad and you felt like you couldn't walk, you would come to me. And so in my first job, I feel like I went into outpatient orthopedics, which is what really called to me. the thing that I like about it the most is that I see probably 10 to 12 patients a day. So I'm interacting with a variety of different people every day. I'm getting to connect with each person on an individual level and touch base on goals. How are we progressing? What's our pain like? What do we need to continue to work on? And everybody's kind of in this different spot within their progression. So I get somebody who just had surgery yesterday, and then I'm followed by, somebody who's doing really, really well, and they're running for the first time since their injury. And so kind of getting that nice variety throughout the day of just people at different places within their care not only keeps me on my toes, it keeps my brain working all day, because I'm switching back and forth too, of like I'm seeing someone who has an ankle injury, and then someone who has a neck injury, and then someone who has a shoulder injury. So my brain is constantly moving and going and working and thinking about how am I going to help these individuals reach their individual goals. So I really like that about outpatient orthopedics. I think in more of like a hospital setting, you have to use those motivational skills a little bit more sometimes, because you're working with individuals who may have just had surgery and they're in so much pain that it's really, really difficult to get them to want to get out of bed. So that's kind of more what that end of the field looks like, of, okay, we're getting them up for the first time since surgery, making sure they're safe to walk or do stairs and that kind of thing. So I've really enjoyed like the pace of my first job. Sometimes it can be a little overwhelming because it's a lot of people to see in one day. There is a lot of documentation that goes along with that. I'm sure everyone here in the healthcare field can resonate with the woes of documentation. That's probably my least favorite part about my job, is having to document everything that I do all day. I have to write a note for every single patient encounter. For an initial evaluation. So if you're meeting someone for the first time, you have to do all these specific tests and measures and things. So it's even more documentation. So just finding the balance between interacting with your patient, getting your notes done, and all of that can be quite challenging at times. But overall, I'm in a bigger clinic with like 6 or 7 other therapists, which I really enjoy. Because a lot of other clinics in outpatient orthopedics will have 1 or 2 therapists in the city, just because real estate is so expensive, I think, in Chicago, that the clinics tend to be smaller, and then there's only room for 1 or 2 therapists to practice and have space for like a gym. So I definitely looked for a bigger clinic because I wanted to be able to bounce ideas off of my peers and have kind of a collaborative environment. So that's something to think about too, of like, do you work better in like a team atmosphere, or do you work better in a quiet atmosphere where you have one other person that you can kind of lean on and that's more comfortable for you? Just as we're talking about things to look for in your first job, I knew that I wanted a lot of different minds to pull from. And so I really enjoy having like a bigger, more diverse clinic for that reason. And I feel like I've been talking a lot, so I'm just gonna stop there.
So I'll jump in there. Yeah, my first job was at a therapeutic day school. So Beacon Therapeutic Diagnostic and Treatment Center. Long phrase. I did not know anything about a therapeutic day school, which is young people who, you have the high school or the whatever, the junior high, and then you have the alternative school, which is the kids who are struggling. And then therapeutic day school is like even more struggle, right? So these are young people who have some clinical diagnosis, and they are just hard to handle in the regular school setting. And so I started off as a TA, then I moved to a behavioral specialist, and then that's also when I went back for my master's in clinical psychology, seeking to help them do it better. So I had ability to connect to people, but I was like, I didn't have enough information. I needed more. And yeah, the day in and day out was pretty tough. I was pretty shell shocked walking in there, seeing young people yelling, cursing, screaming, going from 0 to 100 in their emotional dysregulation. And yeah, it was tough. It was like, what was I doing? And why are these kids so bad? And then who are these people trying to help? And so as I grew, as I got better, it just gave me more passion to meet the needs of young people, particularly young people who aren't helped by the system. So a lot of these young people just slip, and they slip all the way down the cracks to the bottom level. So that's kind of what gave me the passion to pursue, my master's. And uh, yeah, it's also like those open experiences that give you, like, I don't know, like, it impresses upon you like the need for it. And so on the days where you just want to give up, you're like, nah, I gotta keep going. So that was my first job in the field.
Well, yeah, it's interesting. My job is technically my first job as well, because I stayed on and joined the faculty in the place where I trained. Now, over the years that I've been there, I have had new opportunities, leadership opportunities, and growth, certainly in that time. But I have been on the faculty at the University of Virginia since I graduated from my training. And I would say for physicians, I think that it's pretty common to see physicians only be in a few places, if more than one or two in their careers. And that's partly because of the relationships that you build, and sometimes it makes sense to stay where you are. In academic medicine, some people do tend to move from place to place if they're really seeking to climb the leadership ladder, because often to get those bigger opportunities, you have to go from place to place to place to get those bigger opportunities. But a lot of people, even in academic medicine, will stay in the same academic center for much, if not all of their career. I don't know if my whole career will be where I am, but I have been in the same place since I finished my training.
I'm also in my first job, which, again, started with just me in a small rented office space, seeing patients for their skin conditions, and then reading some pathology with a couple of employees. So I'm still sort of part of the same deal, but the journey has been, interesting and amazing. From a clinical perspective, seeing, all these patients over all these years and all these different conditions, and learning, as, obviously the lifelong learning process. And again, from the business perspective, from a small practice to growing a large practice. Although I've been in the same job, I felt like I've had 15 different jobs within this journey. So, I just, it's just so broad and expansive and variable when you go through any career. You sign up for the job and it's like this for a year, and then it changes and grows, and technology grows, diagnoses, treatments, everything is constantly growing. So I think that's one of the things is, you get that job, but, it's always going to change, and you have to keep up on everything as best as you can. So don't know if that answered your question, but that's my thoughts on it.
Yeah, thank you very much for sharing that. Yeah, I've learned very new things for about each field. So that's very interesting. Thank you. And so maybe this might be our last question. See, so like for the entry level jobs, let's start. Well, like for the first jobs, or just like as new, professionals in each of your jobs, like what do you like? How are like the best ways to prepare for them, do you think? And like, what can students, start thinking about now, or like, what are the skills they can start developing now that will be helpful for later on?
We've talked a lot about just developing personal relationships with people, and I think that's huge in the healthcare industry whenever you're patient facing. I think those are skills that are harder to teach. Those are skills that you kind of have to develop on your own, and through your own life experiences, interacting with each other, getting involved in things where you're going to be exposed to different people from different backgrounds, so that you feel comfortable interacting with anyone from, anyone under the sun, because anyone can walk in my door. I'm dealing with the general public, so you just never know who who's going to be your next patient, and you want to try your best to make every patient feel comfortable. I think that's huge in healthcare, is making people feel comfortable with you and the care you're providing. So you have to develop trust like really, really quickly in this field. If people don't trust you, then they're going to move on and go somewhere else. They're going to seek somebody else to help them out. So if you can, you know, in your friendships, in your student groups, and in your life, just in general, really focus on developing strong relationships with people and understanding people and understanding different backgrounds, which I think, like, if you're at Northwestern, you're at a great place to do that. I think that's going to set you up for a lot of success in like the, I guess, soft skills area, because a lot of the professional skills in each of our fields, you do need to go through the extensive training to get, you know, all the anatomy and the biology and all of that. Like there's boxes you have to check. But as far as the softer skills, I think those are areas where you can kind of challenge yourself to grow and explore opportunities that are presented to you, so that you feel comfortable developing those strong relationships and jumping right in once you're in the field. I would say if there are opportunities to shadow in different healthcare fields or industries, that's what I tried to do. I know in physical therapy, at least, a lot of PTs are open to having students shadow just for like a couple hours at a time, just so you can kind of walk a day in the shoes and understand what the job role is like. Because I think if you have at least a little picture of what a day in the life might be like, you'll be able to set your expectations better. And I think if you go into a field kind of knowing what that day-to-day is going to be like, you're going to be more motivated yourself to know, like, this is what I want to pursue. And I've kind of already walked at least one day in the shoes of someone who's doing this, and I enjoyed it and I didn't hate it, because that'll save you a lot of time. You know, you don't want to walk down a path necessarily, and then, you know, you're 8 or 10 years in and you realize you don't like it, and you spent all this time really working towards something that you don't enjoy. And I think that's a real fear, you know, when you're trying to figure out what you want to do. So I would say, you know, take any opportunity that comes at you, even if it sounds remotely interesting and, you know, you're not sure about it, like, just jump in, give it a go. And if you hate it, you still learned something.
All right. I agree with that. That diversity of experience is the same thing I would say. Like, you have to go out, try things, experience things. You learn about yourself and you learn about those different areas. And again, it gives you a story that allows you then to talk to other people. I think I am highly frustrated with specialization too early in life. So as an athlete, I did every sport that I could do, and I think that cross training allowed me to be the better athlete, right? So when I go out and play basketball, people who watch me play basketball, they're like, "Man, you played football," because I'm looking at your footwork, and your footwork is what a football player can do on defense, right? So I think I'm better at a basketball player and better at being a football player. And I was all better in that because I ran track. So I think that the experiences that you have is like, just go out and do different things. Don't try to be, you know, only a biologist, only a psychologist, only like whatever you enjoy, that's great, but be able to have diverse experiences so that you can grow those different areas, those different soft skills, all those other things allow you to be good at what you do when you finally do specialize. But if you specialize too early, you're missing out. You're missing out on who you are, and you're missing out on what other people have to offer you. So diversify your experiences and really try a lot of different things.
I agree with those comments as well. And I would say, you know, if you're thinking of pursuing an MD, of course, it is a challenge that it is a big commitment of time, because it's the 4 years of the MD itself, and then committing to residency and potentially fellowship, which collectively can be a lot of years of your life. I will say one sort of first job thing that we are seeing people trying more when they're considering an MD, or trying to get into medical school and having a hard time getting in, is taking a job as a scribe. Because of the complexity of healthcare and some of what's been mentioned about the documentation and so forth, more and more places will hire scribes. And being a scribe is not a high paying opportunity, but most people will do it for 1 year. And it gives you an opportunity to be dropped right into the middle of a real clinical situation. And a lot of scribes work in the emergency department. So you get to see what it's really like to work in the emergency room. You work alongside nurses and doctors, PAs, all kinds of healthcare team members, or in a clinic. And I would say we've had scribes in our clinics now for probably 5 or 6 years. And most of the scribes who I've worked with have gone on to medical school. And I think they go in with their eyes really wide open about what that is going to be like. So I'm certainly not recommending a scribe as your long-term life plan, but I do think for, 9 to 12 months, you can learn a lot. And it also makes you a tremendous applicant because you can really speak to what it's really like to be there and not just what you imagine it might be like.
And a couple points for me, I think, again, similar to what you had just said, is getting exposure to as much as you can. Say you think you want to be a physician or some other healthcare related field, getting exposure to as many different areas of that as you possibly can. And even if it's just for a half day, maybe somebody whose father is a physician or whose friend is a physical therapist, you can just get in there and get various exposures. You start to learn a little bit more about what you like or what you don't like. And so I think that's invaluable to know what's out there, because the healthcare field, it's massive. There's a million different types of healthcare careers and jobs and all of that. So I think that's a big thing. And then the other thing I think I found with myself, and I think others will find, once you get into your field, for instance, for me, say it's dermatology, I think there's an honesty that I had to have. And that honesty was like, what do I want to do within this field? So it seems so specialized, but as a dermatologist or an OB-GYN or a physical therapist, there's multiple different settings where you can do this work, right? You can do it in private practice. You can do it with a university. You can do bench research and some clinical. You could do in different geographies. You can go underserved. So you have to, I think, decide at some point, what is it that drives me? What environment works for me? Where will I thrive? Where am I the happiest? And honor that because you're going to be doing this for the next 20, 30, who knows, 40 years. And so you want to have a setting where you feel, happy with what you're doing. And those would be my 2 big points.
Thank you very much, everyone, for all your answers or your insights. I think now we're going to move on to the student questions. So Mirabella, would you like to take that over?
Yeah, that would be great. Thanks so much. So students, if you would like to send your questions into the chat, you can do so in the public chat and then I will call on you. Otherwise, if you're not comfortable with that, that is totally okay. Just send it to me personally. Again, my name is Mirabella Johnson. So just look for that participant name and send me a chat and I can read the question out for you. So let's get started. And maybe to get the ball rolling, I mean, I even have a question for you all. I think, well, thank you, first off. And I'd like to ask, I think sometimes at Northwestern, people can get a little bit caught up in the minutia of things like, well, I don't want to disappoint or let people think I can't handle a med school route, and maybe have that interfere with what they really want to do or something they would prefer. So does anyone, I'll kind of leave that open to the panel here. How did you guys go about that and end up in feeling so fulfilled in your careers? I think that would be helpful.
I can jump in with this. I think I definitely had that exact experience, and that's when I pivoted and kind of started exploring other healthcare opportunities. Like I think Samir was saying, healthcare, the world of healthcare is massive. there's so many different things you can do. And I think our exposure to what's out there is very minimal. You know, there's social work, there's PAs, there's nurse practitioners, there's so many different things you can do within the healthcare field. And I think a lot of people only know one or two things. And so any opportunity you can get to kind of get that exposure, I think is great. I know we harped on that a lot already. But I think, you know, I get the sense of like, you know, not wanting to disappoint anyone, and whoever that may be, whether that's peers or family or, you know, whoever that is. But I think ultimately what it comes down to, like now that I'm done with undergrad and into my career a bit, I think I would be very unhappy with myself, first and foremost, if I had followed a path just because other people wanted me to, or I felt those pressures, and wasn't truly happy with what I'm doing. Because if you're not passionate about what you're doing and you're not enjoying your day-to-day, it's going to take a toll on you. It really is. And, you know, then you're going to end up feeling like maybe later down the line that you're going to pivot and you're going to have maybe regrets about, you know, wasting time when you could have been doing that one thing that you love, but you didn't go after it when you initially had that feeling. So I would encourage you to, you know, listen to yourself first and foremost. And I know sometimes that's like easier said than done. Sometimes the hardest part is actually like figuring out what you do want, because a lot of times it takes a while to figure that out. But I think kind of what we've all been saying here is like, take that time now to try to figure it out. And it's okay if it takes a while, but I think exposure and experiences and taking advantage of all those opportunities is going to help you figure it out, because you're going to have experiences that tell you, I don't like this. And you're going to have experiences that tell you, I kind of like that. And it's just going to help you narrow in, I think. So that would be my 2 cents.
I think people's disappointment only lasts as long as the distance to your success, right? If you can show that you're a success in whatever you're doing, like people's disappointment will dissipate, particularly if they love you. And again, it's okay to have other people be disappointed in what track they think you were supposed to be on, as long as you're happy in the place that you're going. So I have a lot of friends who made it through pre-med. I've had a lot of friends who pivoted, right? Took the off ramp from the pre-med track. Would say, and they spending so much money on this or whatever the case may be, but they enjoyed it and they kept going, and they're in a place where they're happy at what they do currently. So be okay with that initial disappointment that people will have, because it won't last long.
I can speak to, you know, I've got 3 teenagers, one in college currently, and she kind of sounded, you know, like she wanted to do pre-med as she went to college and everything. And then just a few months ago, she came to me and said, I don't know if I want to, you know, do pre-med, you know. And I don't know if she was expecting, you know, that her mother and I are physicians, and she was expecting that. But I just told her, I was like, you know, this field or many other fields where you devote, you know, resources and time and effort, like if you don't really want to do that, then I think it's dangerous to force yourself to do it. And, you know, I mean, I'm sure parents and other friends and everybody have certain notions or expectations or thoughts about what their kids should do. But I think at the end of the day, the kid, I kid, you know, she's 19, but they know, or they will have the path to learn and grow and decide what it is that fulfills them. And often that's going to be different from what parents or friends or whoever does. So I think it's very dangerous to just go into something just based on some external pressures. They're not going to be with you every day of your life. And you're going to be the one who's there, who needs to feel fulfilled and happy in what you're doing.
I agree. I mean, you can always reinvent yourself, and I think you should at least once or twice, but something that takes many years to get through if you don't feel passionately about it at the outset. You know, it's just too hard to do it if you don't really love it. I mean, I love what I do, but some days it's still really hard. If I didn't love it, it would be impossible.
Awesome. Thank you so much for that insight. I think we have time for maybe one or two more questions, depending on how the flow of the conversation goes. So I think these two questions that I have next kind of build off of each other and kind of build off of the last conversation we just had. So some of you mentioned kind of hitting a wall with certain academic paths or classes. And then some of you still went through with it. Some of you decided to change course. And so such as with the pre-med path, for example, students are wondering if you have any advice on how to work through those difficulties, or if you changed your path, how you knew that you wanted to adjust your training and go through the years of training that you did instead.
I mean, I'll jump in. I think you just want to try something, right? I don't think there's like, if people are looking for formulas, right? This is not the organic chemistry lab right now. There are no formulas as to the path you need to take. Be okay with the fact that, man, it could be the class, it could be the professor you took it with. It could be the time that you took it with, right? So I took organic chemistry at 8 a.m. and it was the worst thing, but then I took it at 10 a.m. and I did great, right? So think about that. Figure out who you are again, and don't worry about, I think too often we look at other people's pathways and we start comparing ourselves to them. Just go with your own, like whatever way you get there, right? So Vanessa, you left, went back, did some pre-med classes somewhere else. I've had several people who did post-bac where they've gone and did their classes somewhere else and they did it. It was easier. They were at a different stage. They felt like they could just focus on just that. And they did a lot better, and they're doctors now. So I think whatever the pathway, just allow yourself to go your own rather than comparing yourself to everybody else's.
I totally agree with that. And I'll be honest with you all, when I was at Northwestern in organic chemistry, I was watching pre-med students who stayed in the library all night long studying. And at the time, I just found that unappealing. I didn't want to study in the library all night long. And I thought, if that's what it takes, I just maybe am not up for it. Ironically, I work all night long, all the time now. But at the time, studying all night long, I just couldn't believe that it could be right, that that would be what was necessary. And it wasn't necessary. So it did take me some time to come back around and find a way to do it on my own terms, but it doesn't mean that I couldn't. I think in the moment, I actually believed that I couldn't because I was looking at the model of some of my peers and how they were approaching it. And I did not want that approach. And so I thought I was out. And really, I just needed to do it in a different way.
I know I've talked a lot about like shadowing opportunities and things like that, but that's really what I utilized a lot when I was in undergrad, and I kind of had this like pivot moment. I was a psych major, was trying to double major in bio, dropped the bio major because it was just too much. And I ended up not wanting to do pre-med, and I felt like that was the only reason I was doing the bio major. And so really that pivot point for me was I was really interested in neurology because it was like this overlap of psychology and the science behind it. And so I shadowed a pediatric neurologist, and I just absolutely hated it. I really did. And it's those experiences that told me like, okay, I think this pivot is the right move for me. Because I just felt like it wasn't enough time for me personally to spend with a patient. It was a lot of dealing with parents, very anxious parents, as opposed to interacting with children in pediatric populations. And I feel like it just wasn't the vibe that I was expecting. And you don't know until you kind of get in there and get that experience. Whereas then I volunteered in the skilled nursing home, and I was helping with rehab exercises, and I just got to know each patient so well and know their story. So that was like, oh, this is that vibe that I'm looking for, because I want to develop deeper personal connections with people, but also help them in their journey to getting better. So those experiences really, really shaped a lot of my decision making, I think, and told me whether the pivot was the right move or not.
Thank you so much for this awesome conversation. I know we're running short on time here, but thank you all for coming in here. I know that it personally was very impactful for me and students. Let's say thank you, and then hop into the networking session.